Assalamu alaikum. I am Dr. Mahbubur Rahman Polash, Assistant Professor, Department of Pharmacology, Bashundhara Ad-din Medical College. Welcome everyone in our today's session. Today we will discuss about hypertension, a common topics. Let's go for a start. What is hypertension? Sustained rise of blood pressure with systolic greater than 140 mm of mercury and diastolic greater than 90 mm of mercury with respect to age and sex of an individual is called hypertension. What are the types? It has two types: primary or essential hypertension. It's more common on 90 to 95% case, unknown etiology, and secondary hypertension 5 to 10% only. Causes of hypertension. Number 1, positive family history, obesity, high salt intake. Number 2, disease like Cushing syndrome, acromegaly, chronic glomerulonephritis and hyperthyroidism. Drugs, it includes corticosteroid or OCP taking people, and number 4, pregnancy. So these are the common causes of hypertension. Now come to the category or types of hypertension. Optimal hypertension when systolic blood pressure less than 120 mm and diastolic blood pressure less than 80 mm. Normal hypertension, normal blood pressure less than 130 mm of mercury and diastolic blood pressure less than 85 mm of mercury. High normal 130 to 139 systolic blood pressure and diastolic blood pressure in between 85 to 89 mm of mercury. Hypertension grade 1 or mild hypertension when systolic blood pressure 140 to 159 and diastolic blood pressure in between 90 to 99 mm of mercury. Hypertension grade 2 or moderate hypertension when systolic blood pressure in between 160 to 179 mm of mercury and diastolic blood pressure 100 to 109 mm of mercury. And hypertension grade 3 or severe hypertension when systolic blood pressure greater than 180 mm of mercury and diastolic blood pressure greater than or equal 110 mm of mercury. So these are the classification of hypertension. In this figure we can see this is the anatomic sites of blood pressure control, and blood pressure is equal to cardiac output into peripheral vascular or peripheral vascular resistance. Now comes to the drugs used in hypertension. We use several types of drugs as antihypertensive. Number 1, diuretics. It includes loop diuretics like furosemide, bumetanide, ethacrynic acid. Thiazide diuretics, chlorothiazide, hydrochlorothiazide, indapamide, and potassium sparing diuretics. It includes spironolactone, amiloride, and triamterone. ACE inhibitors include captopril, enalapril, ramipril, and lisinopril. Now come to the angiotensin type 2 receptor blocker. It includes losartan, valsartan, olmesartan, and telmisartan. Calcium channel blocker. There are two types of calcium channel blocker: vessel selective and cardioselective calcium channel blockers. And calcium channel blockers include verapamil, diltiazem, amlodipine, nimodipine, and nifedipine. Adrenergic blockers or adrenergic blocking drugs, alpha blockers include prazosin, doxazocin, terazosin. Beta blockers, it includes propanolol, atenolol, and metoprolol. Mixed type, both alpha and beta blockers, it includes levodopa and carvedilol. And centrally acting sympatholytics drug like alpha-methyl dopa or clonidine, and direct vasodilators, it include hydralazine, diazoxide, and sodium nitroprusside. Now come to the centrally acting sympatholytics drug, how it works. Centrally acting drugs is alpha-methyl dopa. Alpha-methyl dopa converts into a alpha-methyl noradrenaline in the brain. Then alpha-methyl noradrenaline is a false neurotransmitter and a potent alpha-2 agonist. Then alpha-methyl noradrenaline binds with the presynaptic receptor and causes decreased adrenergic outflow from brain that leads to decreased total peripheral resistance and decreased blood pressure. Indication of alpha-methyl dopa, hypertension in pregnancy, and adverse effect, sedation, lethargy, and postural hypotension. Now come to the alpha blocker. Alpha blocker is a prazosin. How prazosin acts as an antihypertensive agent. Prazosin blocks alpha-1 receptor in blood vessels, prevent vasoconstriction, decrease total peripheral resistance, and thus decrease blood pressure. These are the mechanism of prazosin. And adverse effect of prazosin is postural hypotension. It is called fast dose effect. Marked postural hypotension and syncopal attack may be occurred. Another adverse effect of prazosin is reflex tachycardia. Precaution to prevent fast dose effect, start with smallest dose at bedtime. So we have to start a very little dose at bedtime to prevent hypotension. Prazosin preferred in hypertension more than other alpha blockers because it has a rapid onset of action and short duration of action. Role of propanolol as antihypertensive agent. Propanolol in heart blocks beta-1 receptor, decrease heart rate and force of contraction, decrease cardiac output. In kidney, beta blocker or propanolol blocks beta-1 receptor of juxtaglomerular cells, decrease renin release, inhibition of renin angiotensin aldosterone system, decrease angiotensin 2, no vasoconstriction, decrease blood pressure. And in brain, inhibition of vasomotor center, inhibit sympathetic discharge and vasodilation. So combined effect decrease the blood pressure. So this is the mechanism of propanolol, how it decreases or lowers blood pressure. Now come to the antihypertensive action of atenolol. Atenolol is a selective beta blocker. In heart, it blocks beta-1 receptor, decrease heart rate and force of contraction, decrease cardiac output, decrease blood pressure. And in kidney, blocks beta-1 receptor of juxtaglomerular cells, decrease renin release, inhibition of renin angiotensin aldosterone system, decrease angiotensin 2, no vasoconstriction, and thus decrease blood pressure. Now come to the difference between atenolol and propanolol. Atenolol is a cardioselective beta blocker, but propanolol is a cardio non-selective beta blocker. Atenolol less lipid soluble, but propanolol is high lipid soluble drug. Atenolol cannot cross the blood-brain barrier, but propanolol can cross the blood-brain barrier. Atenolol has less adverse effect or CNS adverse effect are absent. Propanolol has CNS adverse effect. Atenolol not used as migraine prophylaxis, but propanolol it is used as migraine prophylaxis. Atenolol does not cause any bronchospasm, but propanolol can cause bronchospasm. Now come to the indications of atenolol. It is used in hypertension, mild to moderate hypertension, angina pectoris, myocardial infarctions, and in arrhythmia. And adverse effect of atenolol are bradycardia, hypotension, and cardiac conduction abnormalities like cardiac arrhythmia. Contraindications of atenolol: hypotension, bradycardia, heart block, and acute heart failure. Thank you. This is all about today, and welcome for our next session.